So the question is, what are my sedation options when it comes to getting dental work done, getting implants done? So we have a few different types of sedations that you can do. There's the lightest amount of sedation, which is this laughing gas. I've often heard from people or patients that, oh, I've had laughing gas before, it doesn't work. Well, that still doesn't mean that it doesn't work for you. It may mean that it maybe wasn't administered properly. There's certain things you have to do there, so don't just rule that out. But the nice thing about that one is that you can drive yourself to and from the office yourself. Then you have another level called conscious sedation, where you're still breathing on your own, you're still verbal, we can ask you how you're doing, but you're really sleeping through the process, and we're monitoring you. You don't remember anything in the process, and you do have to have a driver for that one because you're going to be pretty groggy and out of it for the rest of the day, and sometimes even the next morning as well. And again, kind of the same thing. I've had patients tell me, oh, I've had some pills before, it didn't do anything for me. Taking a Valium or a Xanax for someone that's severely nervous won't do the trick. That's more of just taking something to help take the edge off or like help with your anxiety, but that is not conscious sedation. Conscious sedation administered appropriately works really, really well. The downside is you do have to have a driver. You're gonna have that day off, you're gonna be sleepy, and of course that next morning you're not supposed to drive as well. But it's very safe, it's cost effective, it works very well for procedures under about 3 hours or 4 hours or so. Sometimes a full arch dental implant case that's 2 arches, top and bottom both, might last longer than that. But say you're only doing 1 arch of dental implants and you're not anxious and you're pretty comfortable with the dentist, then that can be an option for people. It's a way to save a little bit of money because it's not as expensive as the next option up, which is called IV sedation or general anesthesia. You have options of that where you can either have the dentist or the surgeon can give you the IV medication to help you sleep through the procedure, and you are sleeping through the procedure for this one. In our office, and what I'm a big fan of is what's called general sedation, where we have some CRNAs come in that travel to hospitals all around the city here to do major surgeries where they're monitoring you. I'm doing your surgery and they're actually just making sure you're asleep, you're comfortable. It's a nice, safe way to do it. That one does have the highest price tag with it because there is the anesthesia group that we're bringing in to provide this, but it works extremely well. And people wake up and they don't remember anything. It's kind of like taking a flight like you're in first class. You're just relaxed, it's easy, we take care of everything. You arrive at your destination, you're happy, relaxed, feel like you've had the best nap you've ever had. I got a little long-winded on that one.